They work best when they're allowed to work early, and will there be enough of it to make a difference in Arkansas's coronavirus case count? The preventive that warp speed produced, how fast will it get here? Who will get it first? Where and how? We'll speak with a medical professional who's been dealing with the crisis since its first days in the Arkansas Delta. But first, a plea from the governor in prime time. His Secretary of Health in a moment on Arkansas Week.
Support for Arkansas Week provided by the Arkansas Democrat-Gazette, the Arkansas Times, and KUAR-FM 89.
Hello again, everyone. Thanks very much for joining us. In Northeast Arkansas, additional resources and updated approaches are being deployed to help deal with the coronavirus pandemic. And in a moment, we'll more on what's being done and how it could have a significant impact in a region hard hit by the virus. But first, with more than 20,000 active cases and almost 3,000 deaths, Arkansas would seem some distance from flattening the curve as the Christmas holidays are ever nearer. We're joined now by Dr. José Romero, Secretary of the Arkansas Department of Health. Dr. Romero, Secretary Romero, thanks again for being with us. Is there much basis for optimism as we head into this? We're just a couple of weeks away now from Christmas.
So, again, this is not something that we can stop completely, but we can mitigate it. Again, the recommendations that we've had out before are still the same. Wear your mask, watch your distance, and wash your hands. Again, travel should be only essential travel. This is not a season to be traveling to see your relatives and friends. But we can begin to lessen the number of cases, but we may not be able to stop it.
Well, your boss, the governor, requested prime television time this past week for a major address to discuss the situation. Apparently, or so it would appear, he's not going to ask for any, or impose any more stringent regulations on commercial or economic activity than already. Is that your understanding?
That's what I understand from his address to the Arkansas public. I have not heard any discussions from him about that at this time.
Yeah, as a clinician, as a physician, would you prefer that he goes farther than that? Is it time for more stringent measures?
I think that the governor is acting as he views the entire situation, because it's not just the issue of disease in the state, it's also the economic issue. So at this time, I think our hospitals are able to handle the number of cases we have. We want the public to be responsible, because this isn't just about a single mandate or multiple mandates. This can be implemented without those if the public takes this seriously.
Well, is the public taking it seriously, though? There are widespread reports that it's not necessarily taking it seriously.
The cases indicate that there's still a lot of mixing of people, and that they're not maintaining social distancing. We think that a lot of these cases are coming from home environments, from small groups, not large group gatherings. Our data here at the health department doesn't show any particular site where this is occurring, where these transmissions are occurring. We monitor the number of cases, which we link back to restaurants or to gyms or other sites, and we don't see that at this time.
Well, in terms of educational facilities, there has been some encouraging data of late in terms of public schools or classrooms being less communicated, or not as aggressive in terms of communicating the disease, the virus, as perhaps was originally feared. Can you comment on that?
Yes. So yes. So there was a report from the CDC that shows that schools are not a site for transmission into the community. And so we're watching that also very closely to make sure that that is the case in our state. But the data suggests that this is correct, that the schools are not a site for transmission out into the community, which is good news.
Well, yeah, and yet we still have a significant number of educational facilities, K-12 facilities in the state, that are in the hot zone, are we not? What's responsible there? What's driving that?
Again, it's the community itself that is the issue. That is transmission within the community. For us, for Arkansas, COVID has now spread from just areas where there are foci or areas where it is being transmitted to being widely transmitted throughout the community. And that's where the community has to realize that even when you're out of the house, when you're in an environment like your office, you need to wear the mask. That's the recommendation by the CDC, indoor mask wearing as well as in crowds. So all of these things need to be put into place if we're going to slow this down. At
the state, at the regional, at the national level, the medical experts are urging individuals to avoid holiday travel if at all possible and to hold gatherings to an absolute minimum. Is that likely to make a significant dent?
I think it will make a dent in the number of cases that we see if we hold to that. We've seen surges after Halloween. We saw increasing numbers of cases, and as of yet, not increasing numbers of hospitalization after Thanksgiving. Now, Christmas is certainly a big holiday, especially for family gatherings. So it has the potential to add another surge of cases on top of what we already have. And again, New Year's the same way. So it is up to us, it is up to the public to adhere to these recommendations. This should not be viewed as another Christmas like any in the past. We have to make sacrifices this Christmas in order to get through this period of time.
In terms of treatment now, Doctor, we have several institutions across the state that are now employing antibodies, monoclonal antibodies, and in a moment we'll be speaking with a representative from an institution in Northeast Arkansas about its deployment of that. Is this a real ray of sunshine in terms of treating COVID?
I think it has a place in treatment. I think it can actually decrease the number of individuals hospitalized. So these antibody therapies should be administered as an outpatient, that is, before the individual is hospitalized. And the hope is that by using these, we can decrease the number of individuals that have to be admitted. Now, the sobering piece of information on this is that there are not enough supplies to really saturate the market and to get enough of this to us. But we have our supply of this. We're using it as appropriate.
Well, in terms of judging what is appropriate, there are some restrictions, are there not? Or some guidelines, anyway, as to the applicability of the antibodies.
That's correct. It should be used as an outpatient. It should be used in individuals that have a confirmed diagnosis of COVID infection. Both the availability right now of both PCR and antigen testing within the community makes this very usable in an outpatient setting. In infusion settings, in emergency rooms, it can be done. It could even be done in nursing homes if there's appropriate backup and support to do that.
All right. In terms now of the accessibility of vaccine, it's a little uncertain at this particular hour when the vaccine authorization will come through. It appears to be imminent, though, or is that in your information? And if so, what's likely to be the supply dynamic in terms of vaccine for Arkansas?
Yeah, I believe the EUA will be signed no later than Saturday. At this point, the committee called the Advisory Committee on Immunization Practices from the CDC will be meeting today in a little less than an hour. And then if the EUA is authorized on Saturday or anytime before that, ACIP, that's that committee by the CDC, will meet. Right now, we are scheduled to meet on Sunday, and at which point we'll vote on the recommendations and the authorization, and then vaccine can be administered. We suspect that we will receive vaccine here in the state anytime from Monday through Wednesday of next week. That is the information we've received from the CDC.
And is it still the protocol, anticipated protocol, that first responders and frontline medical personnel will be the first to receive? That's correct. So it's healthcare personnel writ large. Now, again, I've said this before.
it also includes that staff that keep the hospital running. So we're talking about janitorial staff, those individuals that deliver food trays to individuals who have COVID. That also is included. So, and then first responders can include in that group, and long-term care facilities, and the employees that take care of those adults in those centers.
Now, in terms of personal protective equipment for frontline personnel, is that supply chain, have we been able to maintain that supply chain? Has that problem been overcome?
So at this time, we have sufficient PPE for our personnel throughout the state. We are monitoring that very closely. We make sure that we have enough, and at this point, I've not been informed that we have a shortage in any of the PPE that is necessary.
Okay, in terms of intensive care personnel, though, and units, where do we stand now? That has been a kind of a trigger for the situation, has it not?
Yes. So the issue is not so much ICU beds. I mean, we have enough beds in the state, and we can surge and certainly create more beds. The issue really is staffing. And so we are constrained by the fact that this surge is not unique to Arkansas. It's across the United States. And because of that, unlike in the spring, where it was, let's say, in New York, for example, and we could send nurses and personnel there was a supply available. Now there isn't a supply because every state is holding on to their own, or contract nurses and are being sent places where it's more financially lucrative to do so. So we are constrained in that area. Right now we have the staff to man this, but in the future this may become an issue.
We are still competing, in other words, for traveling nurses.
That is correct. That is correct.
And the financial implications of this for Arkansas health facilities, public or private, are pretty substantial.
They can be, depending on how much they rely on traveling nurses. So it's going to depend on each of the different institutions across the state to determine what their reliance on this is. We are working to deal with this issue of COVID patients within the state. We're setting up networks for which we can transfer patients very quickly without having to spend a lot of time trying to find a bed. We have begun to think about surge capacity and are beginning to set up sites or possible sites for expansion of care if necessary.
If necessary. Looking at the numbers so far, Doctor, mindful that we've got a holiday coming up and that voluntary compliance has been a bit iffy in some areas, are we going to have to pull the trigger on that aspect of it? What's your best estimate?
Not at this time. Oh, pardon. Excuse me. No, not at this time. We have enough beds at this moment. We are monitoring this. We have enough ventilators. Yesterday was actually a positive day in that we lost a lot of individuals that had been discharged from the hospital, so we had more beds available. I think that's all good. We're monitoring this daily. Secretary
of Health, Dr. José Romero, thank you very much for being with us. Come back soon. The larger counties in the Arkansas Delta, Craighead and Crittenden especially, have been among those reeling from their coronavirus caseloads. In Jonesboro now, St. Bernard's Medical Center is the latest Arkansas clinical facility to administer monoclonal antibodies to patients diagnosed with COVID. The results frequently encouraging, yet the treatment is not necessarily for everyone. Not necessarily. We're joined now by Dr. Connie Hill, a vice president at St. Bernard's. Ms. Hill, thanks very much for being with us. Is it too early to get some really clinical feedback on the antibodies and what they're able to accomplish?
Well, it may well be, but we do know that the antibodies have been proven to neutralize the coronavirus when administered. We are administering it in our region under an Emergency Use Act from the FDA and to certain populations of people. We've given through yesterday about 90 doses. The other hospital here in town has given about 80. So it may well be be too early, but we are seeing some stabilization of our numbers of hospitalizations. So that is encouraging to us. Now, we will probably see how the Thanksgiving get-togethers affected by this weekend, and then we still have Christmas to get through. So any prevention of hospitalization is our goal at this point.
And the antibodies can effectively, it's hoped anyway, limit that hospitalization rate.
Yes, by neutralizing the virus. And the patient still has to isolate after receiving the monoclonal antibody for their 10-day period of time. And so they still are shedding virus, but it decreases the virility of the virus in that person and neutralizes the virus in that person and helps them develop antibodies against it.
Well,
helps their own body fight it.
Yeah, it doesn't necessarily stop the virus in the patient in its tracks, but
that's correct.
But it does ameliorate the symptoms and the aggressiveness anyway of the virus.
That is correct, because when the virus enters our body, what it does is it attaches onto our own cells and then replicates inside the body. So that is one of the goals, of course, of the vaccine, is to stop that attachment. But in monoclonal antibodies, we help the body to fight and build antibodies against that virus and neutralize it.
Now, it's our understanding that it is most effective the sooner it is deployed after a patient is diagnosed. Is that why?
That is correct, because those are the types of patients that the studies were performed in. And so that is the data that we have right now, is that if it is given early in the course of the illness, and the recommendations from the FDA are to administer it within the first 10 days of symptoms, and the earlier the better for mild to moderate symptoms. The patient needs to be an outpatient. They need to be not using oxygen related to the COVID virus, and be able to, be ambulatory.
What are there beyond that? Are there some demographic recommendations or standards for those who should receive the antibodies, like age, race,
yes.
ethnicity?
Yes. So what the Emergency Use Act addresses is that for certain age populations of patients, so there is for a pediatric indication that would be for individuals over 12 years of age, over 40 kilograms. Those individuals in the young age category would be a candidate for the antibodies if they have a immunosuppressive disease, if they have a chronic obstructive pulmonary disease like asthma, if they are dependent on a trach or a gastrostomy tube. So those are higher risk people. From there, age 55 and older becomes a candidate if they have certain chronic illnesses such as diabetes, hypertension, obesity, and chronic obstructive disease. And the reason is because we have seen those people are greatly impacted by the virus. And then finally, anybody over the age of 65 is considered high risk and immediately a candidate for the vaccine.
How available either in Northeast Arkansas, Jonesboro, and St. Bernard, or other facilities there, and statewide are the antibodies now?
So I know that in the United States, 330,000 doses of the antibody have been deployed. Each hospital, each state receives an allocation, and then each hospital within the state is allocated a certain amount each week based on their number of hospitalizations and based on their positivity rate. So each Wednesday we turn in our request, and on Fridays we typically receive a shipment. So on average, we're receiving about 70 doses a week right now.
In terms of the vaccine, Ms. Hill, now the story is moving almost faster than we can keep track of, but the latest indications on Friday are that federal approval could come this weekend and distribution begin in earnest within hours. What is the protocol there in Northeast Arkansas, if not statewide, in terms of deploying the vaccine itself?
So that's a really good question. And, these are really interesting times for us. We are hoping and anticipating that we do receive the vaccine this weekend. And when we will be there when it arrives on our docks. It does have to be stored in a very, very special type of freezer. Although I was very impressed with the drug companies in that for facilities who don't have the special freezer, the actual container that it comes in has been constructed in such a way that it will act as the freezer when replenished with dry ice under specific conditions. So each state has a plan for indicating which hospitals will receive allocation and also which pharmacies in the state will receive allocations. And so then within each hospital, the guidelines for us, again, under the Emergency Use Act through Warp Speed project, is that the first phase will be that the vaccines will go to healthcare frontline workers who are taking care of COVID patients or who are at risk to be infected with the virus through patients, and first responders. The first responders, unless they're employed by you, will likely be vaccinated through the pharmacy programs. Within each hospital, then, the hospital takes those guidelines and then establishes a protocol for vaccination of their staff. Larger hospitals are going to receive larger doses. We are expecting about 975 doses, and this is this will be the Pfizer vaccine, and it will be two parts. We will give the first injection, and then the second injection will be given about 3 weeks later.
When it does become available in such quantities as to make it available to the broad public.
Right.
Are you, as a clinician, are you concerned about resistance to political, social resistance to vaccine?
Well, I think there will be some people who don't want to take it. And this is the first vaccine that we have that is a messenger RNA vaccine. Some of the other vaccines contain live viruses or an attenuated dead virus. But the great thing about this virus is it's very new technology. It's a messenger RNA vaccine. And the way that works is it is a synthetic messenger RNA that is injected into the body and then tells our own body how to form the antibodies. So you cannot get the virus from this vaccine, and I personally will take the vaccine.
That was my question. Is Dr. Connie Hill going to take this vaccine?
Yes, I will take the vaccine. As soon as I'm offered it, I will take it.
The spread, obviously in metropolitan area, in Jonesboro, West Memphis, they're metropolitan areas. You're growing like Topsy.
Yes.
But now the virus is beginning to, or it has for quite a while now, taken a toll in rural areas where access to health care is not as accessible. Health care is not as accessible as, say, in metropolitan Jonesboro, Paragould, and that area. That has to be of concern to you and other clinicians as well.
It is, and it affects the rural areas differently for exactly the reasons that you have said. We have very rural, very diverse population that doesn't always have access to health care, and in some areas doesn't even have good quality access to a primary care provider. So the network of our rural area does look to Jonesboro to answer those questions for them. We have a very strong network of rural hospitals who we are in touch with daily and weekly regarding surge plans, regarding use of the monoclonal antibodies, as well as plans for the vaccine. So we know that the rural areas look to Craighead County for leadership, and we're ready to step up for that.
The governor was in your city just a day or so ago.
Yes.
And apparently the administration's position right now is not to do very much more in terms of economic slowdown or shutdown than what he has directed thus far. Is that adequate? Are you satisfied with that? Would you have him be more aggressive?
What I would like to see is everybody participate in wearing a mask. Even if it offends you, it's just a mask. We're just asking you to wear a mask. I think that is something that everyone can do. Wear a mask, wash your hands, and keep social distance, and not gather in large crowds where you don't protect yourselves. So I know the governor is in a very difficult position right now. But I am very supportive of all the measures that he has taken. I think all of us have to take personal responsibility to mitigate this virus. This will pass, but it's going to take everybody to keep the numbers low. So I think it's a balancing act, to make sure that we keep the public safe and at the same time move forward with our everyday lives. And so we can do that if we all just participate in the very basic measures of mitigating the risk.
And got to end it there, Dr. Hill, because we're simply out of time. And we thank you very much for yours.
Thank you so much.
Come back soon. And that's our broadcast for this week. Thanks for joining us. As always, see you next time.
Support for Arkansas Week provided by the Arkansas Democrat-Gazette, the Arkansas Times, and KUAR-FM 89.